Jenna. My name's Megan.
My name's Jensen.
And I'm Brendan.
We're going to be your nurses today.
I don't understand why I have to be here.
Okay. Well, you were recently diagnosed with type 2 diabetes, correct?
And I'm doing great with it.
Okay, can you walk us through what you mean by doing great with it?
I check my blood sugars and they go on that machine, and I post on Facebook all the time that I'm doing well and eating what I'm supposed to. So.
Can you describe to us what your diet looks like?
Oh, you know, my mom makes me eat salads, so
How often do you eat salads?
every day.
So you mentioned that your mom is the one that's preparing your foods. Do you know what kind of foods you should be eating while having type 2 diabetes?
No, not really. I mean, I just kind of eat whatever she tells me to. She thinks I'm fat, so. I mean, I obviously am because I have type 2.
Well, it's not necessarily mean that you're fat. Your body mass index and your weight is definitely manageable. Those are things that we can take care of due to like increased exercise, an improved diet plan.
Well, every time I exercise, I sprain my ankle, like I did in gym.
Maybe we can find things like taking your dog for a walk or simple activities. Just start out slow, but increase your exercise slowly. And then that way you won't be injured or, find things that you can enjoy.
Okay. I guess I could do that.
So our last blood results for you, as you know, we took some labs from you. Your hemoglobin A1C is at a 10.2.
What does that mean?
Yeah, so of course that's gonna be tough to understand. But your hemoglobin A1C is the amount of glucose binding to your red blood cells over a 3-month-long period. So you know how you do that finger prick and you get a quick number and it's like 156 or like 120. It tells you what your blood sugar is right then and there. So this percentage is it's a better way for us to interpret how you're managing your diabetes, if that makes sense.
Mm-hmm. So is a 10 good or a bad? Or
And that's what I'm leaning to. So a 10.2 is a little bit higher on the scale. So we're looking for like a 7% or lower, and you're up in a little higher range, which can be dangerous for you. So you said you're being compliant with everything, and that's tough for us to kind of think that it's true based on your lab results. So anything that, do you understand how to use your glucometer and how to draw your blood and everything and measure your blood sugar?
Yeah, I poke my finger and it hurts, and then I put the blood on the strip and it reads.
How often do you check your blood sugar?
Once a day. I hate doing it.
Okay.
And are you taking your metformin daily?
Yeah, I have to make my mom do it, but I don't remind her if I have to.
Okay. Well, sorry.
It's okay. How often are you taking it?
I think I'm supposed to take it once a day, but I'm not really sure. This whole thing is whatever. It's not going to affect my life. I can still do what I need.
Metformin, it's prescribed to take twice a day, before breakfast and before dinner. So if you could set reminders to remind yourself, it's really important to comply with all this. Type 2 diabetes can eventually lead to many more complications, and so we want to prevent those before it gets too far.
And then you mentioned earlier that you check your blood sugar about once a day. And I know it can be a chore and it's definitely annoying to have to go through and read your blood sugar, but you're gonna want to do it before each meal, so at least 3 times a day, breakfast, lunch, and dinner, just to keep tabs on how you're doing throughout the day. Then you know when you put food into your body, how is it affecting that number? Or if you exercise, how is it affecting that number? It kind of gives you a better log of how your body's progressing throughout the day.
So I have to do it at school?
You do have to do it at school. That would be somewhere, do you have a school nurse or a room that you can go to?
Yeah, I just don't want to go there and look like a freak.
That's understandable. I mean, you could definitely try and talk to her, have your mom talk to your counselor or some sort of administration person to get you a pass. So you could leave maybe 5 minutes before class and just kind of slip out and then still meet your friends in the lunchroom.
Okay. I guess I could start doing that.
Mm-hmm.
And earlier you were talking about your diet. You just eat whatever you said. It's important to have moderate carbs, moderate protein, and low-fat meals. So we can come up with some meal plans and give them to you, and maybe you and your mom can make them together. Just focus on your diet. It's a big part of this.
Yeah, that means you want to limit your sugary foods just because that increases your carb intake, so cut down on the sweets too.
And you can start in moderation. Doesn't have to be, everything at once. And once in a while, you can indulge in your favorite snacks, but not like a regular thing.
Okay, I guess. I mean, it is what it is.
Mm-hmm. It's just important for you to be proactive in your, process of this whole thing. It's new to you, but the more involved you are with your dieting and your maintenance of the disorder, the more you'll be able to manage it, and you'll be able to live with it throughout your life, and it won't be such a taxing thing on your body.
Yeah, you can live a great healthy life with this. You just have to manage it, but you can definitely live a normal healthy life.
Well, and see.
All right, disclaimer, blood glucose, Nurse Assist Scott was 242. We already looked that up. She's gonna get 4 units of insulin. Blood pressure is gonna be 110/80. Pulse is gonna be 90. Respiration's 12. Temperature is normal at 98.6.
Hi Jenna, my name is Rachel. I'm going to be your nurse today.
My name is Caitlin. How are you feeling?
I feel like I'm gonna throw up.
Okay. Well, your blood glucose was 251, so we're gonna have to give you some insulin, okay? You need to lower that,
Okay.
okay?
Have you taken insulin before?
I take metformin. I don't know if that's it or not.
Okay. So, do you know why you're here today?
I feel really sick and I don't really know what day it is, or I don't know. I just don't feel good and my mom made me come in.
Okay.
Have you had any other signs and symptoms besides being nauseous and a little confused?
Have you been dehydrated at all, or?
Increased thirst?
I mean, I've been
Urinating a
pretty-
lot?
Been pretty thirsty, but every time I drink, I know that if you drink a lot, your pee turns different colors, but it's really dark right now.
Okay.
Okay. Alright, well, so we gave you some fluids, so
Mhm.
hopefully that will help with your dehydration.
And I'm gonna give you some of this insulin, okay?
Okay.
So I'm gonna clean your, do you wanna lay back? Or you wanna sit? That's fine, we'll do the back of your arm, how about? I'm gonna clean off your area.
Alright, so we checked your blood sugar, and it was 242.
I'm not taking the cap off ever on this. Poke and a burn, okay?
Do you check your blood sugar at home?
Alright, all done.
Yeah. I went to the doctor's office. They told me to check it more. I checked it last night. I
Okay.
checked it this morning though.
Okay.
What was your blood glucose last night when you checked it?
It was high. It was higher than normal.
Okay.
Okay.
Has the doctor come in and talked to you about your diagnosis?
No. I haven't
Okay.
seen him all day. Right here.
Well, we'll talk with you a little bit about it. So you were found in what's called diabetic ketoacidosis. Okay? So that shows us that you have not been taking your medications as prescribed. Have you been taking your metformin 2 times a day?
I've been only taking it once. I really don't like poking myself.
Okay. So if you don't have enough insulin and your blood sugar's too high, that would cause the diabetic ketoacidosis.
So it's usually characterized by fruity breath, your polyuria, which is increased urination, your increased thirst. You can tell by the color of your urine that it was dark, right? So usually that means you're super dehydrated. That's also a sign. Racing pulse, decreased blood pressure, which you probably wouldn't have been able to see, but we noted that when you were in the ED.
Your confusion as well.
Your confusion and your memory issues. So you're here now. We are going to get your blood glucose back in the normal range. So that's going to be done with the insulin, right? So like I just poked you. So we'll come back and check your blood glucose again to make sure that it falls within the normal range. And if it doesn't fall within the normal range, we are going to continually give you that insulin to get you back down to normal. Do you know what normal blood glucose is?
No.
So we'd like to see it around 80 to about 110 with before meals, right? Because when you eat meals, it spikes.
So that's with my disease.
That is with type 2 diabetes.
Okay.
So I understand this can be very hard to deal with as a 14-year-old. but that's why we are all here, us nurses and your doctors and your healthcare provider, your primary healthcare provider, to help monitor your type 2 diabetes and to get you back to where you need to be with your glucose levels and your nutrition.
Yeah, if we can help you maintain it at home, you'll have less chances of getting this sick again. So if we continually check your blood glucose when you're supposed to, and we teach you how to use your insulin and everything like that, and diet and lifestyle, you can maintain it a lot better.
I mean, well, I know when I feel nauseous, it's not a good feeling.
No.
So, if we can keep this under control, we can avoid DKA in the future, and I assume you don't want that to happen again.
No, I feel pretty bad right now.
Okay, so we'll teach you. I know we're giving you a lot of information now, but you'll have to give your insulin based on what your blood glucose is.
Mhm.
So we'll teach you what the scale is. We'll give you a printout of the scale and what you need to reference when you're giving your insulin. Think your mom would be able to help you with that, or?
I mean, she's good at it. I have to. I don't like poking myself. I can't do it.
Okay.
So, what don't you like about poking yourself?
I can't bring myself to harm my body.
Okay, it's a small needle. I know I don't like needles either. It's a small needle. So, are you having pain with it, or it's just the fact of poking yourself?
I think it's just the fact of getting over the fear of poking myself.
Okay, so there are some strategies that we can help you hopefully get over that fear in the future. Now, you are normally on metformin, which is an oral medication. So, are you poking yourself? You're talking about the blood glucose monitor?
Mm-hmm.
Okay. So, when we're using the blood glucose monitor, where are you poking yourself on your finger?
It's
Show
right
me.
at the top.
Okay,
Okay.
so, go ahead.
Oh no, I was just gonna say that's good.
So it's actually good to poke yourself on the side of your finger because it has less nerve endings. So if you clean it off with alcohol, you let it dry, you can milk your finger up to make sure there's blood there, and then you poke, and then let some blood, and then you'll wipe it off, and then push again, and then you'll read. Okay, so that should be less painful than the tip of your finger. And if it's not, then we can maybe see if there's something else causing the pain.
Do I always do this finger?
So
No, you'll want to rotate fingers because you're going to be doing it a couple times a day. So you'll want to rotate your fingers and which side of your finger you're using.
My finger's gonna look deformed.
No.
I actually take my blood glucose almost every day. Can you see anything different? Okay. We will be back to monitor you. If you feel anything more nauseous, dizzy, don't be afraid to hit your call aid button. We will help you get up to go to the bathroom, and we will be talking with doctors. And when your mom comes in, we will talk to her more. Any questions?
And then just so you know, we'll be checking your blood sugar before every meal while you're here and then before bed as well. So we can get you feeling better and get you back on track, okay?
Sometimes it might be every hour because you're still in DKA. So every hour we will be checking your blood glucose to then manage to get you back down in that range.
Hi Jenna, how are you doing today?
Okay.
Good to see you.
I'm Taryn.
I'm
I'm
Astu.
so we'll be the nurses at the school that you'll come down and see every day before lunch.
Okay.
How are you feeling now?
I don't know. I feel pretty nervous about being here, but
What makes you nervous about being here?
I don't want kids thinking that something's wrong with you.
Well, no one will.
No, yeah.
No, you'll leave class 5 minutes early before lunch. You'll come in here, and by the time they're getting let out, you'll be walking to the lunchroom with them. So
what am I gonna do here with you guys?
We're just gonna check your sugar, your blood sugar. Make sure that you are like checking it regularly.
So you guys will have a monitor or
Yeah.
my monitor.
Yep.
Yes.
We'll have a
We will
monitor here that we'll keep at school for you to come down every day to use and check it right before lunch. Have you been checking it at home since you got out of the hospital?
Yeah, I don't want to feel like that again.
Okay, that's
How
good
was
to
it?
hear.
How was the numbers?
Well, they've been going down. This morning it was like 120.
All right. You taking the medication?
Mm-hmm.
How often?
I took one this morning.
Okay.
So then you'll take one at dinner time?
Yeah.
Okay.
Okay.
So do you want to walk us through how you check your blood glucose?
Sure. So I would wash my hands, I guess,
Mm-hmm.
and let it dry, and then I would get my monitor, and I would poke my finger in the side so it wouldn't hurt as much. And then I would test my blood and let it read, and then put this stuff, get the stuff to you to dispose of.
Okay.
That's good.
Looks like you know how you're doing it. So we're just going to be here to help you walk it through every day and make sure that we're getting it done.
Do I come here if I don't feel good too?
Yeah, if
Yeah.
you don't feel good at any part of the day, you can come down. We can check your sugar to make sure you're not either hypo or hyper. Then
Do I have to come back after lunch?
I mean,
No.
you don't need to come back after lunch.
once
Like
a day
maybe,
before lunch is
um,
good.
Okay. Cool. I guess I could do that. Are you guys gonna be like keeping tabs on me? Not like attendance.
Well, we want to make sure that you come every day so that we can keep a log and we'll give it back to your mom and the doctor so that they can make sure that the lunchtime one is, your levels are staying in range.
You just don't want you to go back to the hospital for the non-compliance. It doesn't feel good.
We're here to help you. So we'll do our part. If you do your part and come see us every day,
I guess I could do that.
I know it's not easy, but you will get used to it.
okay? You're good to go to
You're
lunch.
good to go.
Awesome. Sweet. So we'll start with scene 1.
So do I have to fit it?
Okay, scene 1, why you did what you did.
Well, we talked about going about like Jenna being kind of
Non-compliant.
non-compliant and just being kind of sassy towards everything because she doesn't really want to do what she wants. So that's how I kind of went about it.
Yeah, and I think we all did like patient education, trying to make her understand like the complications or, you know, why she needs to follow through with this.
Yeah,
It's just gonna get worse.
she can like go on with like living a normal life, and she doesn't have to worry too much about the drastic changes as long as she like manages it well.
Yeah. The biggest thing for us in this scene was just noticing that the A1C was 10.2, which is an increased level out of normal range. So we knew that she wasn't being compliant with what was going on. So just going back, walking her through how to administer, when to,
Yep.
and the importance of keeping it low.
Yeah, and then her diet and lifestyle and
Baby steps, yeah, you talked about baby steps.
Yeah.
Yeah.
Thought it was good that you guys just didn't take my answer for the food, like, oh, I just eat salads. Like, you guys kind of like dug more into it.
Yeah.
Yeah.
Okay, that kind of touched on the second one too, because it said what were your concerns and how you maintain safety, and then why you chose the education techniques that you did.
I would say, like, keeping in mind that she was 14.
Yeah.
Like, she clearly, this is a big change in her life and her lifestyle, and having her understand that, like, her being a part of the whole change is like big for her, like because this is going to be something she has to deal with for the most part for the rest of her life.
Yeah.
So she gets it really under control.
And then how would you transfer this knowledge to real world practice?
I feel like it was kind of real world.
Yeah.
Yeah.
Like you could give that same education to, I'd say anybody, any age really.
Yeah.
It was easy to understand, I feel like.
Mm-hmm.
Scene 2?
So scene 2, so why we did what we did. So
I mean, she's in DKA, so
yeah, so we need to get that
We need-
under control.
yeah, she needed the insulin. So
And then she needed to know, we educated her on signs and symptoms, and why she was in DKA, so that's important to know, to avoid it down the road. And then the education techniques, we didn't wanna put too much on her at once, cause we're just trying to get her healthy for the time being, so.
I mean, I feel like it's important to know like how the patient is feeling now, so they can relate that to like, oh, I don't want to feel that again, and I don't want to go through this again. I don't want to be back in the hospital. She's 14, so
Right. And I thought
hopefully that helps like
Mhm.
snap
Yeah.
on her to be
And
like,
I
right,
thought it
wanna
was
do this
really good
anymore.
how you like actually showed her how to like
Do the
test her
Yeah.
blood
Yeah,
sugar.
and like
Mhm.
reduce the pain because
Yeah.
obviously
But
she's
she
pretty
was-
anxious.
Yeah, because that
about it.
was so maybe now she'll be more compliant with that.
Yeah, and you guys acknowledged her fear of
Yes.
Yeah.
doing it, not just
Not just ignore
yeah,
it.
your mom can help you. You guys
Yeah.
actually
Right.
Yeah.
walked her through it.
That was like and the importance of doing it, so she doesn't come back to this.
Well, I mean, she doesn't like pokes, right? And now here I am.
Pokes, yeah.
Right. More,
she's
more.
gotta get
Right,
used to it.
more pokes. But
But
Yeah.
that's good to teach her like to do it on the side so she doesn't feel the pain because she show it at the
yeah,
school.
that's it, yeah.
Mm-hmm.
So I guess the last thing, how will you transfer this knowledge to real world practice?
Well, again, I think that could have applied for anyone, if even an adult or someone who's done it before, have been through that before. I mean, it's still the same things they need to follow and work on and check. So
I just really liked, like I know, like that is a big fear for me, like poking myself, like I really don't like it. So, but like Caitlin, you did a really good job of like addressing that fear and not just being like, yeah. And I
You
really
have
liked
to.
how you like came over and showed me that you poke yourself and that
Yeah.
you showed me on
Yeah.
like with my finger like where to do it. I thought that was very good.
Yeah, that
Yeah.
Yeah,
But
that's
you
right.
can use
really
in
good education.
real world.
Yeah.
You can show your patient, I do it myself.
That's good
You can do
application.
it
Yeah.
too. That's nice.
Marie, so why did you do what you did?
I feel like we did what we did because when she walked in, it was our first time making sure that, since she's been out of the hospital, introduce ourselves, making her feel as comfortable as she can, and making her feel like it is a safe spot to come, that she is away from everyone for that 5 minutes of time to be able to check her blood glucose and be in control of it.
And she was worried about like her friends to know that something is going on, things like that. So we kind of like let her know that she can leave early, 5 minutes or like 3 minutes early, then came to us, do it, and then that's it. She can go with her friends, have lunch or dinner, nobody will know.
Yeah, I thought it was cool
Yeah.
because I had mentioned that in the first scene, and then you guys kind of tied it back together, which I thought was a good.
Yeah.
I thought we did a
transition
really
and
good job
everything.
tying everything back together.
Yeah.
I mean, it's a true thing, like 14-year-olds, like that's a really
Yeah.
vulnerable stage for especially
For
girls.
her,
Yeah.
Especially you can tell she has low self-esteem. Like she
Yeah.
thinks that
Yeah.
there's something really wrong with her.
So we just try to implement that.
And that's the last thing they want to be known for, is going to see the school nurse being someone like
Yeah, like
different
Yeah.
at school,
Yeah.
having to go down there, like, so to make it as discreet as possible, it's like she's just going to the bathroom during the end of class, not
And
like,
I think
oh,
she
you
know
have
now. She know now better on how to control it. She know like
Mm-hmm.
like what is going on if she don't like.
Yeah. I think
Check
you
her
guys
sugar.
gave good resources because you guys were like, if you don't feel well, like you can come here for like anything.
For like any, yeah.
And you also, like I know in the reading, Jenna, you know, like did the blood glucose, like changed it or had her friends do it, but now like having this scenario where she has to come in, you guys are literally handing the report to her mom or her parents, like it's just
Mhm.
getting rid of all of those things. And I can't get access to that, so I think
Right.
it's a
They're
definitely,
like
It's a
right
little
there
more
doing it.
independent.
yeah, it makes it more like accurate where I can't like go behind somebody's back and
Yeah.
Your
Yeah.
friends.
And it kind of helps you do it on your own, but also like they're there to help you
Yeah, I
and
thought that was
support
cool.
you. Yeah.
So how would you transfer this knowledge to real world practice?
Kids go down to the nurses
Yeah.
in the real world, like, every day, and so if you end up being a school nurse, you need to know that it is a big deal for the kids, that they need to feel support and that
Yeah.
they're not being different, there's just part of their daily thing, and you're to make it as easy as possible for them to transition to that.
Yeah. What I thought was really cool that you guys talked about with her is like you guys are doing your part as long as she does her part.
Her part,
Yeah.
And it's
yeah.
like it wasn't like you were there to like take over the whole situation and do it for her. You're still like
Right.
supporting independence and allowing her to like do it herself while helping her if she needed it. I thought that was very like real life, real world
Yeah.
practice.
I think we did a good job overall.
Education was pretty consistent
Yep.
throughout.
Yeah, lots of education.
Big time. Alright, all set?
And done.
It's like
That's great job.
Yeah, good job, guys.